various things that we could put together to have some publication or some presentation at a meeting or a learning and sharing platform. So once again, thank you very much for joining us. And I'll ask that, please indulge me and let us pray. Our Father, we thank you for today. We commit our session into your hands. We pray that you be with us as we start this whole training series of workshops. Be with us, grant us understanding, and glorify yourself in our lives. In Jesus' name, amen. So we'll just look at why are we here today? And the idea is so that we can identify opportunities for engagement. A lot of us have been practicing for a while, even those who are very new to the practice of pharmacy, at least a year. And in that practice, you may have observed some things. And indeed, as pharmacists, we observe so many things all the time. But some of the things you may think is interesting. This is something I can share with a group of people. Maybe you get the opportunity and you share it with your friends, but that may be something that could be life-changing, that could be practice transforming. And so the idea here is we want to look at opportunities that may be available for us to identify options that we could come up with to help us in sharing our knowledge, sharing our findings, and sharing our skills with other people. Some of us may also have identified some things that we think this is great, it would be good for us to share, but the focus is still blurred. And so we are hoping that by the time we've gone through this series, if you had some ideas which were not sharp, that the focus on what it is that you can bring and share with the rest of the scientific world will be sharpened. For some of us, we know exactly what it is that we want to share. Indeed, we have a very sharp focus, but we have no idea how to present what it is that we know we want to share. And so at the end of the sessions, when we have wrapped up in December, we hope that we will all be able to design something that will get the attention of the people we want to engage with. There may also be some of us who we have been able to design something we've shared, but sometimes you realize that when you are presenting, you are not able to capture the attention of the people you are speaking with. You are not able to give all the information. Maybe you realize you've left something out which you should have added, or at the end of the day, you think you've added some information that was really not necessary. So we are hoping that when we have gone through everything, we should be able to improve our presentation skills. Now, when everything is over and everything is wrapped up, at the end, we should be able to move from ideas, the ideas that we have as practitioners, the ideas which may be blurred, the ideas that we have not been able to design yet, and take them to publication. Now, the publication is not only the written publication, but oral publication. So we may have the opportunity to share with other people, whether it is in person, whether it is on a platform like this, or even to just share it with any group of people that we may come across. So we will discuss today's session, and then we will look again at a general thing, generally what it is that we want to do, and then we'll go into our breakout rooms and have the training. Through today's session is Dr. Francis Braco. I'm coordinating this whole training workshop with Dr. Bracco. He is a lecturer of pharmaceutics and formulation at the Medway School of Medicine in Kent. And he will give us the summary of the program and also introduce the faculty that will be taking us through the sessions throughout the year. But I must say that Dr. Bracco was trained in Ghana, and he has a feel of what it is that we do here. But I know that it's not only Ghanaians that are joining us. And so for everybody everywhere joining us today, you are very welcome. And with that, I will hand over to Dr. Bracco. And so Dr. Bracco, if you are with us, please take over. I'll stop sharing so that you can now take over and share. Thank you very much.
Thank you very much, Madam. I will be sharing my screen so that we can continue. Just a minute, please, whilst I...
Dr. Bracco, you could send it to me and let me help. Let me share from here for you.
Yeah, I think I have it now. Please kindly confirm if you all can see my screen.
Yes, we can see you. Yeah.
That's why I'm waiting for you.
Okay, so this is a very short presentation that will attempt to introduce all the topics that we will be going through throughout the year. And it's our expectation that each topic will deliver value to we as pharmacists in terms of our own personal development, as well as progress on our profession as pharmacists. So the title is you are a pharmacist, so what next? I think that our profession is one that is actually a research-based practice, because we learn on outcomes from our day-to-day activities. So it will be very desirable that we are effective in communicating whatever experience and observations we get from our work. Okay, but as many of you can recollect, the kind of training we have in our in our universities, especially at the first degree level, we don't emphasize academic writing as much as we will be helpful for our development. And so it becomes necessary that at the postgraduate level, we take up opportunities to train ourselves on how we can communicate outcome from our work as effectively as possible. That is the purpose of this training. So why do we need to learn to write at all? I know that we are able to communicate, we are able to engage with other stakeholders in our day-to-day professional activities and so on. But if we are able to improve upon our academic writing skills, then that can also contribute to we increasing how effective our personal communication is. As pharmacists, we usually communicate with other members of the healthcare team wherever we are working. If we are in hospital, we are communicating with doctors, nurses, biomedical scientists, and so on. And then when we are in frontline practice, we are also communicating with service users. We know by now that the kind of terminologies we can engage our colleague pharmacists with, that will not be the same kind of terminology we will use to engage service users like patients. And so it's very important that we are skilled in deciding what audience we are communicating to and choose our words and our styles appropriately. This session can tell us to be more effective in that regard. And then we will be able to write better proposals that hopefully can attract more income to support many of the activities we are doing. We will be able to present outcome from our activities better. We will learn how to present more effectively. And hopefully for some of us who have been desiring to put out our thoughts, our observations, our experiences among the scientific community, we will be able to have some go at publishing. So in this course has been designed to be a postgraduate level course. So many of the instructors are people who routinely teach postgraduate students, postgraduate researchers. And because we have all completed our first degree as pharmacists, we believe it is a good point to start from the postgraduate level. So that is how it will be. It's intended to be very interactive and very engaging. So you don't just come in and listen. You come in, you hear something from the instructors, you learn something, and then you go into smaller groups where you are able to put some of what you have learned into practice there and then. Okay, and the content is relevant to our profession. It is academic writing, but I believe we know by now that the kind of academic writing that will be relevant for engineers may not necessarily be relevant to pharmacists. So this course has been designed to be relevant to our profession. And then we will be exploring different dimensions of academic writing that can be in the form of writing out journals or presenting our work orally, or even presenting our work by way of posters, such as we will do in conferences. So this is what we will be looking at it. So the sessions are grouped under 3 main themes. So some of them will show us the basics of academic writing. Then we will have an opportunity to utilize these bases into composing things that we can actually ultimately publish. And then we will see the process through which we can go to deliver our work out there. Okay, you can have a very good journal draft, but if you don't go through the appropriate channel, you may never end up getting it published by a reputable journal. So we will learn all the steps that we need to go through to make sure that our work is published in an appropriate forum. So the first topic that we'll be looking at is plagiarism. And in the academic community, plagiarism can be a very serious offense. In the universities, for instance, it can lead to the withdrawal of students when you are found to be repeatedly committing this offense of plagiarism. So it is very serious offense among intellectuals. Okay, but the problem with plagiarism is that it's very difficult to detect or to distinguish what is plagiarism and what is not. Okay, and one of the best insurance policy against plagiarism is to be able to correctly reference any material that you cite in your write-up. Okay, so we'll be looking at plagiarism, what constitutes plagiarism, what it is not, and how we can avoid it in our attempt to communicate our work as pharmacists. Then we'll be looking at referencing. So when you are writing something, more likely, not everything that you put down will be your original ideas. You may want to depend on other people's thoughts to reinforce your point. And in doing so, you may need to reference certain materials. How do you do this correctly? If you do it correctly, then you are protected from any offense of plagiarism. Okay, but it's not as easy as it seems. There are so many kinds of referencing styles. There are so many ways that we are allowed to reference a particular kind of material. How are we able to distinguish through this? We will get an expert who will walk us through all these things and make sure that we are very effective when we are citing our work. For us to do very well in citing our references, there are various referencing software that are very easy for us. They make our writing easy. They help us to organize our literature sources, and then we can easily cite them. Now, some of us who have been through academic writing, you realize that it is very tedious to manually organize all your references. You may be writing an article over a period of 6 months, and by the time you come to the end, you realize that some of the earlier sources of material that you use for your work, you can't even remember where you took them from, let alone get the details of them and include it in your bibliography. When you have a referencing software and you are utilizing a referencing software, all these things are better organized and they are used very easily. So we will be going through this as well. Then we will have an expert to take us through what we title copyright and intellectual property. Okay, your writing can be a great source of worth, but it can also be a great source of dispute and misery. How will you be sure that you are not infringing on other people's copyright or intellectual property? And how will you ensure that whatever original idea that you have brought, especially when it has some very good commercial prospects, how can you protect it? Okay, we will be looking at all the steps that we can take to ensure that our original ideas, some of which can lead to big commercial fortunes, they will be appropriately protected so that we can have some returns on whatever commercial activity that they lead us to. It's very important. Then we'll be looking at literature search. Okay, some of us may not be necessarily writing on primary source of information that we have generated. Some of us are very interested in certain topics, in certain areas, and we want to sometimes even write a review, an expert opinion on a subject matter that is relevant to our practice. We may need a literature search. What are the databases out there? There are so many of them, and each of them is suited for a particular content. How do we find this? And when we have found them, how do we have access to them? And when we have access to them, how do we utilize the resources that are available in these databases? Again, we will get one of the facilitators taking us through this so that we can make the best out of our literature search, should we need it. The next one is writing an abstract. Now, many of us may be aware by now that sometimes if you want to attend a conference, you need to send an abstract of your work to them. Sometimes if you want to present something that is highly concise, but capturing the full thought of whatever thing you want to communicate, you need to write an abstract. For instance, when the director of your institution wants an insight into some of the projects that you have been doing, that kind of communication will be in the form of abstract. A highly concise writing that captures the full thought of whatever thing you desire to communicate. Okay, we should be able to summarize our work precisely without losing any part of the message. How do we do that? abstract writing is a skill. There is a proper way of writing abstracts that communicate our thoughts effectively. We'll be looking at this as well. Then when for instance, we have presented an abstract to a conference and the conference have accepted it and we are meant to do a poster presentation, how do we do a poster that can really attract some audience? Okay, you go to conferences and you see some particular posters. The content is highly relevant. The color schemes are very coherent. There is a well-balanced text and image combination. The font size is appropriate. You can clearly read it from a distance without having to go so close to the poster. The layout is appealing and the whole poster is visually appealing. How do people do this? We will be going through the steps that will ensure that in future, if you have to do a poster presentation in a conference, you'll be able to do that. We are very grateful to God that the world is opening up again. And very soon we will be traveling for various activities, including attending conferences. And we will have the opportunity to present our posters. How will we ensure that our posters are the go-to place for many people attending a conference? We will be looking at this. Then designing a presentation. Oral presentation. When you stand before a podium and you are given even 5 minutes to deliver the content of your work, it should be a memorable one. People who attend a conference where you have presented your work orally, they should go back to their various countries and remember that particular presentation because of how it was able to capture and sustain audience attention. There is a skill in doing this thing. How are we able to do it? One of the main sessions in this program will be looking at designing a presentation where you are able to present your work in the most confident manner, in the most memorable way, and then you will eventually attract the applause of your audience. We'll be looking at this. Then presenting your work. You need to know your audience, you need to know the environment, and you need to understand your message. How are you able to combine these 3 key elements to present your work very forcefully? We will be looking at this too. And then when we have gone through all the sessions, I'm sure many of you will have some things at the back of your mind or on your desk, somewhere in your office where you have been planning to get it out there, either in newsletters or in journals or even on websites of certain relevant organizations like WHO, like many other websites that are dedicated to communicating advancements in healthcare and so on. We will have the opportunity to bring all these things from our closets, from our desk, from our mind, put it together and see how we can get our work out there. So who are the people facilitating all these things? The Ghana College of Pharmacy has worked very hard in collaboration with experts from both Ghana and the UK, and they have put together very skilled and knowledgeable faculty who are able to give us the best as far as academic writing is concerned. So we have Dr. Franklin Echampong. He is the head of research at Kolebu Teaching Hospital. He's one of them. Then we have our own rector, Madam Yvonne Renchua Eseku, who is at the Ghana College of Pharmacy. And she will also be participating in this. We have Dr. Maxwell Casley Hayford. He's a pharmaceutical chemistry expert at the Medway School of Pharmacy, and he will also be presenting some of this. We have Dr. Mariam Pariska from UCL School of Pharmacy. UCL School of Pharmacy used to be the London School of Pharmacy, which was very popular with KNUST because many of the faculty in KNUST actually trained there. So we have, and then we have Dr. Asma Bwans. Dr. Asma is a pharmacist by profession, now a lecturer in pharmaceutical engineering, and she is also based at the UCL School of Pharmacy, which used to be London School of Pharmacy. Then we have Dr. Francis Brackon, who is from the Medway School of Pharmacy, also as part of the faculty bringing together this set of seminars. Then we have Dr. Lebene Sogalok. Dr. Lebene is a lecturer at University of Reading. And he started out as a pharmacist, actually started working in Kolebu and subsequently in Starwin Pharmaceutical. And then now he's a lecturer in entrepreneurship and leadership. He will also be taking some of the aspects of the seminar. Then we have Dr. Vivek Trivedi. He is based in UK. He's an expert in pharmaceutics and formulation. He has over nearly 2 decades of experience working in industry as well as working in academia and research. And he will also be presenting on some of the seminars. There are a few more others, like our own very experienced literary officer, Oscar Bruce, who will also be presenting on some of the topics, and a few more who will be helping us to deliver this thing. So just to sum up, let's do this thing. It is possible. We can be more effective in our work as pharmacists when we are communicating all the observations and experience and the know-how that we are generating. And I think this is a very good thing that the Ghana College of Pharmacy has put together. It will equip us, it will make us more confident in our academic writing. It will make us start looking out for so many of the opportunities out there. There are so many grant opportunities out there, but you have to write and compete with other pharmacists from all over the world to attract this funding to support your work. But when you are confident that you have the know-how to do exactly what is required, then you begin to get more successful in attracting these grants. Some of them can fund your travel expenses to attend certain conferences. Some of them can be useful for building your portfolio, where you can actually engage your employer for instance, promotion, because you would have published regularly some of the observations you've made from your work throughout a number of years. So I think there is more to gain from this thing. I will encourage everyone who is here today to make it a point to attend all the 10 sessions. And then whilst going through all the 10 sessions, be thinking of an area where you have always wanted to publish your work. And then as we go through, see how you can apply some of the skills being obtained to develop your work bit by bit. And then by the time we come to the end of the year, you will have a draft ready that you will be very close to publishing in a reputable journal. Thank you very much. At this moment, I will hand over to Madam Renjua Isiku. Thank you.
Thank you very much, Dr. Brackon, for your presentation and for introducing us so well to this program. And before we even talk about what we will be writing, I think we will start off with even sharing our ideas, and that will be the first thing that we will be looking at. So thank you for giving us a summary of the program and also for introducing the faculty to us. I'm sure that for those of us here, you have whipped our interest to the point that we will continue with all the others. So we'll continue with the session, and please let me know, can you see my slides?
Yes, please.
Thank you very much. So now we are going to look at the series itself and then take our first workshop session today. Oh, I seem to have, okay. Now, this is how we are going to go through our sessions. So we will, as we have started today, we will have an introductory lecture, just as Dr. Bracco has given us. But in the for this one, this is a broader introductory lecture. But for the subsequent ones, each one will have the topic. The introductory lecture will be based on the specific topic for that day, for that session. And it will give us, that lecture will introduce to us some concepts that we are supposed to put into practice, and also give us an assignment. And we are going to go into breakout sessions and take the assignments. We expect the introductory lecture to take no more than 30 minutes. So between 20 and 30 minutes would have finished. Then we go into our breakout sessions. And in the breakout groups, these breakout groups will change, or may change, or may remain the same. I mean, we are not going to assign specific groups to people, but rather we will go into the breakout groups as we come in. And when we go into each group, we will ask that each group will select a rapporteur who will effectively coordinate the activities for the group and also report to the plenary when we come back. The breakout, during the breakout group, we expect that each group, during the breakout session, we expect that each group will practice the assignment that has been given. And we will do that today. And then after the breakout session, we will come into plenary for another 30 to 45 minutes. The expectation will be that in that period of 30 to 45 minutes, we will give some brief reports. So a few groups will report to the plenary what they came out with. So if it is designing a poster, the poster that they have designed. If it is designing, preparing an abstract, what they have actually prepared. Then we will all discuss. So a number of groups will give us those presentations, and we will all discuss and learn from them. And please, there is some noise in the background. If we can mute our, thank you. Then when we have finished with our discussions, we will wrap up for the day. So this is the structure for each session. For each workshop, when we come in, we will have an introductory lecture. Then we'll go into our breakout session, and we'll come back into the plenary. And because of the practice that we would have had in the breakout session, at the plenary, we'll be able to share and discuss and learn a few ideas, share a few ideas, and go with us for the day. So when we put all of this together, we do not expect to exceed 2 hours in any session. And so we'll ask that we all join early so that we can have our sessions and have a fruitful session. Because if you miss the introductory lecture, for instance, and you join at the time of the breakout, then really what you will be doing will be now listening to others making their contributions, and that may not be very beneficial for everybody in the group. So let's talk about what we expect, that is from the Ghana College of Pharmacists perspective. We are hoping that we'll get active participation from everybody present. We are hoping that we'll all share our ideas freely, in the faith that if somebody has an idea which has gone quite far, nobody will take that idea and run with it, but rather we will share knowing, trying to help one another build up our competencies and find ways of identifying our ideas and opportunities ourselves. We are expecting that we will utilize the concepts that have been learned. And so when we come for the next session, we expect, for instance, that if we had practiced maybe citing properly, by the time we are coming for the next session, members would have had the opportunity to practice what has been done in their spare time or in the course of the month before we come for the next session. And when we have finished, we expect to see pharmacists, all those of us here, publishing. And on that note, I would like to mention the fact that the Ghana College of Pharmacists has brought out its first edition for the GCP journal. And if you have not seen it yet, take the opportunity. You can go to our website. We have the articles there, and see what other pharmacists have written and see how we can all contribute. So when we have finished, we expect to receive a lot of publications and ideas for publications from the Ghana, that is, to receive them at the Ghana College of Pharmacists Journal. Now, what can you expect? That you will be exposed to concepts and ideas for research and publishing, and that you will get opportunities to put your learning into practice. As we have explained, at least on the day it is designed as a workshop where you will have the opportunity to put the concepts into practice, and that your presentations will be ready for delivery, and that your articles will be ready for publication. We are also working currently on getting CPD points for these sessions, so that in addition to everything, to cap everything off, you will get a few CPD points for having participated. So not only will you finish with your articles and your presentations ready for delivery, but the time that you would have spent here, you will have some CPD points to take away with you. So today, becoming a researcher, pharmacists make observations every day. When we go through the prescriptions, when we are supervising production, when we are assuring quality, when we are giving information to our patients, whether in the hospital or in the community, when we are part of the public health teams and providing all the services that are necessary, we make observations. These observations we usually incorporate into the engagement that we have with healthcare professionals and with our patients. And so we provide them, and they are beneficial to the health of our patients and our clients. But these observations are also the beginnings of good research findings. And so it is possible for us to come up with questions that concern the medicines that we are given, questions that concern the patients. Perhaps, for instance, patients who come from a particular group of area will tend to take some kinds of medications, and we may find, and maybe we may attribute some causes to that. But that thought of finding out what it is, why it is that this group of this category of people will go for this kind of medication rather than that, or will go for this formulation rather than that, is is a beginning of something great for research and to share knowledge with other pharmacists and other healthcare professionals. And indeed, questions when we are discussing healthcare, whether with other healthcare professionals, whether with our patients or with anybody else, and the pharmacy practice. When we meet as practitioners and we discuss our findings, all of those become areas from which we can pick up ideas, undertake research, and publish the research. As I said earlier, there may be some of us who may even have documented some of the things that we have observed. And so this is the opportunity for us to start honing those ideas. So today we will go in our breakout rooms, and I'm sure our breakout room will be ready very soon. In our breakout rooms, we will introduce ourselves. We are not that many. I think we'll be having 10 breakout rooms. And so in those 10 breakout rooms, we will each introduce ourselves. As we said, we will appoint a rapporteur. Then amongst us, we will come up with interesting observations at work. So please, as I talk, start thinking about some of the things that you remember. It may be yesterday, last year, during the lockdown, and just interesting observations that you have made. Let's put them together. Now, when we have come up with those, in that same group, we will discuss among ourselves what are the possible areas of research. So for instance, if I have observed that when people come into the community pharmacy, they will always say they have lost their mask, their face mask in COVID. That may be something that we want to research on. Why are the people always saying they have lost their face mask? Is it that they really do not have a face mask and so they need a constant supply? Or is it that they think the disease is gone and so they do not need to wear it? Or is it that they see it as an opportunity to take face masks from the community pharmacy? This may be a good point of research and to understand the concepts and the ideas that our patients have when they are coming into the pharmacy. Now, if it is that they do not have, then how can we address that? Are they always ready to take and pay for the face mask, or will they rather have it given to them for free? So these are all things that we could talk about, write about, and publish, and find out what our patients are doing, what our patients are thinking about the practice. So then we can come up with possible areas of research and perhaps look at potential off-label use of medicines. Now, sometimes our first inclination is to say that that is not the best way to undertake some research into medicines. However, we know of medicines that were originally designed for one treatment, and in time, as observations were made with respect to their off-label use, these medicines have now been repackaged or repurposed for use in other condition management, in the management of other conditions. And so the off-label use is not always encouraged, but if we observe that in our practice, it may be something that we want to look into and see how we can best take advantage of that, or how we can deal with it. If we see, for instance, that off-label use is detrimental to the patient's health, then we have to look at how we can design an educational strategy to help our patients use the medicines better. So I think right now, please, my IT department, can you confirm that our groups are ready? Then we can start going into our groups. Just put us in our groups for the next 20 to 25 minutes. I think we can start that now. Thank you. So give us 2 minutes while the groups, the Zoom room
Sorry for that. So please push there. Thank you. And at the same time, thank sure I'm gonna check. Did you take off yourself or she's just knitting? Oh, okay. Maybe there's some other time. Just give me a bottle of water. Oh, if you bring some, a bottle of water. I think there's some there. No. Or there's some in. You will check if there's some. So you can have it. Thank you. Thank you. That's it. Oh, can't see it. Let me start for sure. The view of I could say on to Oh, Mrs. When are you here?
Hello.
Let me answer.
Hello.
Good afternoon.
Please, we are starting. Let's be on our feet. Let's rise.
Yeah, aesthetic treatment, and I said, body.
It must be Fiji. Hello, welcome back.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone. Thank you.
Nice to have all of you back. Please, can we are back in the plenary. Host,
thank you very much.
Can,
welcome. Yeah.
Welcome back, everybody.
Hey, too much noise. Why?
Yes. So welcome back, everybody. I think it was a great session. I managed to go into a few of the meeting rooms. Some of them, the engagement was so much. There was so much activity. It was exciting. There were a few rooms that I think we probably should have gone into each room before we joined others. So there were a few rooms where there wasn't a lot of activity, but it was exciting. So I think now that we are back in the plenary, the time was short.
You cut us short.
Yes, we actually
room
thought,
7.
Yeah. we set the time for everybody. Actually, it was the same time, but in some places there was a lot of discussion. So it means that once you are excited about what is happening, the time runs very fast. So thank you very much, and we will take some comments. I see pharmacist John Smith from Sierra Leone here with us, and it is so wonderful to have him around. Maybe if we have a little time getting to the end, we will hear a few words from him and his experience with the Ghana College of Pharmacists and his experience in Ghana generally. But for now, let us take maybe 2 minutes for about 3, 4, or 5 groups to tell us something from their workshop, and then we can discuss and wrap up. So we can start with volunteers. You raise your hand, rapporteur, you raise your hand, you tell us the room you were in. That is if you know the room you were in. And then we can go on. Yes. Okay. Great. So we'll start with pharmacist John Smith. Tell us 2 minutes, 3 minutes maximum. I'll be timing it so that we stick to time. Please go ahead.
Dan, thank you very much, Rector. Once more again, I'm happy to hear your voice after a long time and return home back. I'm in group 2. The discussion was very basic, based on the observations that we are told to actually discuss around from our workplaces. So issue came up with regards to hypertension. So colleagues, we are saying elderly patients most time got to take their medications, and sometimes they report when the pressure or will have gone to some level. That is the time they will report to the facility. So from his end, he is looking at why patients do not monitor their blood pressure as advised until probably when it's increased. That is the time they will run back maybe on emergency and come back. So he's asking why that is happening. So from that point, maybe we can start developing research questions from there and see to have several reasons. Another point also discussed with regards to that is from Dr. Wisdom, is family planning devices. So he said with the various devices we have, the methods or the formulation, the dosage form. So he said he's observing that the clients prefer injectables, especially the depot injection, the Provera. He said they will come to the facility, they will explain to them about the other options, but most of the clients are going for the injectable. So from his point, he's saying maybe most of them are saying because of the 3 months duration. So he's saying we are thinking of asking a question, why patient visiting health care facility preferring injectables over others family planning devices. So we might want to take the discussion later to maybe go down to manufacturers and start telling them that it's better we have more of the injectables in the market, because so that the others maybe will not get expired in store or whatever, because the clients are not preferring that. So with regards to that, those were the few points. Since they're also part of the group, maybe what I could not remember to say, they can also speak up and add up to my points. Thank you very much, Rector.
Thank you very much. And you did it in exactly 2 minutes. So good show. Thank you. So pharmacist Kulong Pedo, please take over.
Thank you. So please, I was in room 7 and there were 7 of us. So we talked about, for the interesting observations at work, we talked about lack of responsibility and poor attitude towards work on the part of some government or public sector employees. And we said that we realized that most public sector employees tend to focus more on the remuneration aspects of it than the tax. So maybe we could do some research into that and then find ways of getting them to think more about the tax, because once you perform your responsibilities well, your employers would have no choice than to remunerate you properly. And then we also talked about self-medication in the community pharmacies, where clients come and they tell you what they want, and when you refuse to give it to them, it becomes a whole lot of, back and forth. So we said that with that too, we can do some research, talk to the right people, ask the right questions, and then we find out how to, get the public to see the damage that does to us. And then we also talked about the misuse of medications and the off-label use of medicines. And we cited a few examples where we said that some people tend to crush tablets that are supposed to be swallowed whole, or they break them and then they apply them directly on their wounds. And some people also open up capsules and put the contents in their creams and stuff, or in their wounds directly. So we believe that all these three areas are possible areas of research with a lot of observation and a lot of right questions. Thank you.
Thank you very much. You've also managed to do it in just under 2 minutes. So thank you. Pharmacist Mark Norte, please.
Thank you. So we were in group 3, and then we had about 7 members: Mr. Friye, Albert, Philippine, Akia, Boachansa, Naomi, Sam, and Francis. We had some very interesting observations being shared. For example, I just heard group 7 alluding to one of them. One of our colleagues observed that clients would rather crush penicillin tablets and put it directly in their source, and she thinks it's a potential avenue for data to be gathered to understand such health-seeking behavior. In addition, we also observed, some of our colleagues observed that instead of going for a prescription for prescription medications, clients would rather come with the box or the packaging and request for it until something happens, and then they change their pattern of health-seeking behavior. But more data could be gathered as to why they prefer to do that than to go back to see their doctors. The same or a similar observation was shared by a colleague who rather highlighted that clients will come with a specific brand because of some adverse events they might be experiencing versus other brands that would have been given to them at the pharmacy by we also had insights and observations that referred to antibiotics, antimicrobial prescription patterns in the hospital. And meanwhile, majority of the cases seen at the hospital are actually outpatient cases. And so there should be some tools to evaluate how prescription of antibiotics happens or pertains within the outpatient or outside the hospital. And that was suggested as an area that would also be of interest for research and publication. And lastly, observations were shared that our clients would have gone onto Google to find out some information about the medicines they come and make requests for. Probably we could also investigate further to find out whether they have access to accurate information when they do that, and to understand why they do that rather than listening only to their healthcare worker. That is the summary for group 3. I would invite members if they have any additional point to make.
Thank you. So we'll take the additional points after every group has made their submission. So Pharmacist Bertha Benasco, if you can speak.
Okay, so we were in your group. I've forgotten the number anyway. But we're 8 now.
I think group 9. That was group 9, I think.
Okay. So I would highlight a few of the observations we made. Abuse of antibiotics, in spite of education on the part of pharmacists to discourage patients from doing that. And then also, patients usually don't know the names of their medication, and they identify them by colors and shapes. And then another observation that was made was that patients who have chronic disease condition hardly go for doctor's review appointment, and they usually come into the pharmacy and get refills. Those who are also on medication sometimes don't even know that the dose has been increased or reduced. Then when it comes to prescriptions, some observations that has been made is that most prescriptions that come into the pharmacy is not valid. The prescriber's contact number is not on it, and many other information is not on it. You only find the patient name and then the medication. And also some abbreviations, standardized abbreviations are made, which perhaps comes from non-medical personnel writing the prescriptions. And then also, patients who walk in to the pharmacy to check their glucose level or blood pressure, when it is found that it is high and the pharmacist suggests that they refer them to the hospital, they are adamant, they don't want to go. And then also patients who are critically ill, and for instance, they have malaria, they come in and they request that they should be given injections or infusions. And another observation that was made was how some cold chain products are stored. They are not stored appropriately, you know. So these are some of the observations that we enumerated.
Thank you very much. Thank you so much. Pharmacist Justice Jones, please go ahead.
Thank you. I've also forgotten my group number. I'll still go ahead. Yeah, so
Yes.
we have about.
I think you were in group 4.
Group 4, okay. So
Yeah.
we had about 13 observations and topics.
Wow.
Which is quite a lot. So I'll plead with you to go through all very quickly.
Okay.
So the first one is why prescribers are putting newly diagnosed hypertensive patients on antihypertensives for a month. Why the protocol says that we should do that for 2 weeks. So we want to know the reason or the rationale behind that. Then the second one is most of these patients who have hypertension or these chronic diseases come with pain, chronic pain, and they are overly overdosed in terms of the duration of treatment on NSAIDs. So if the patient is prescribed the antihypertensive for, say, 2 months, then the medication is also written for 2 months. That's the NSAIDs. So we want to know the effects that this is going to have on their kidneys, especially. Then, respect to the same chronic kidney disease, you want to know, as herbal medicine as a cause of chronic kidney disease, that are they the actual cause of kidney disease? So you want to know what actually is causing it. If it's the herbal medicine, then what at all in the herbal medicine is causing it? And then the next one is some group of patients have been observed to have a high risk of glaucoma, and yet they don't have any signs of this glaucoma, which is to say they have eyesight. And whether it's because of lifestyle or whichever thing it could be, which is affecting them for them to have this, continually have this good eyesight. Then for the fourth one, the fifth one, saying that prescribers are usually writing prescriptions for malaria outside the malaria policy. For instance, a patient is given IV medication without even properly confirming the diagnosis of malaria. Then the next one is, it has been observed that COVID-19 booster shots are giving off more side effects than the previous one. So if we could go into it and know what at all is in the booster shot that is making patients or clients respond in that fashion. And the next one, there's an increase number of patients reporting to community pharmacies for treatment of vaginal thrush. So we want to know what is actually causing that. Is it the change of environment or change in lifestyle or whatever it could be? Then another is a prescription of statins. And it's been observed that a lot of prescribers are not going according to the available guidelines. For instance, a patient who has diabetes should be put on a statin, but that patient is not. Why is it? And even those who are prescribing the statins are failing to do a high intensity for these patients. Then also it has been observed that from the ages of 20 to 30, we have the rise of essential hypertension in these patients, in this group. So we want to know what is actually causing that, because most of these patients come in with elevated blood pressure. Some even end up developing kidney diseases and then heart failure, amongst others. Then we also want to look at the use of the thiazolidine diones in the management of diabetes. The efficacy of these medications, cost-wise, availability, amongst others. Then also how the risk of diabetes complications are assessed in the diabetic clinic, because it's becoming routine where patients come and their blood sugar is within the normal range, and then we leave it like that without actually assessing their risk for developing complications such as blindness, kidney disease, etc. Then we also spoke about health financing in the respect to one particular medication, which is insulin, that it's been observed that once patients who are on insurance and receiving their insulin medications from the hospital, once the hospital runs out of medication, they are hesitant to buy them from community pharmacies and would rather wait until the hospital gets stock. And the effect on the community pharmacies is that the communities are not able to stock these medications because of the risk of them expiring on them. So what is really accounting for such behavior amongst these groups of patients? And the very last one, which is a lot of walk-ins in a community pharmacy come in to get amoxicillin, and they claim it is for management of pain. So we would want to look at the role that amoxicillin plays, whether it has anything to do with respect to management of pain. I think I've gone through all that we captured for our group 4. Thank you so much.
Thank you very much. Pharmacist Amos Afeji, please go ahead.
Okay, thank you, Madam Rector. Well, I don't remember the group name, but I know that we were 7 of us over there. And we made several observations.
I think you were in group 5.
Okay. For our group, the observation that we made included the fact that there's a high default rate among HIV clients to the HIV clinic. So we think that I research to find out what may be causing the high default is of interest. And then we also made an observation of high attendance of clients to the community pharmacy in this era of COVID-19 for self-medication. So our interest is to find out why the sudden increase in attendance to community pharmacies for self-medication. We think that if we are able to access the knowledge of clients on COVID-19 and then knowledge on self-medication, we could have a very interesting research piece on that. And then we also made an observation of high attendance of chronic liver disease cases in our hospitals, especially to the teaching hospitals. We want to find out what is causing this increase, whether it has to do with herbal medicine or how we go about treating the condition in the hospitals. And then the other observation was on how we have different treatment regimen for peptic ulcer disease. We want to see how each and how doctors or institutions adopt the various regimen for the various treatments and compare it with what is in the standard treatment guidelines and see the similarities and the discrepancies and what is influencing the choice for a particular regimen and how patients are responding. So these are the observations that we made, and we think that a research into these various observations will bring out very interesting results. Thank you.
Thank you very much. I mean, these are wonderful ideas. And perhaps what I will add to generally some of them are to find out, I mean, some angles that could come along is not just maybe why patients are doing something in particular, but on the one hand, what pharmacists can do, whether it is in the community pharmacy or in the hospital, to improve patient outcomes. And on the other hand, the actions that community pharmacies can take to take advantage of the situation. And when I talk about taking advantage of the situation, I don't mean taking advantage of it in terms of the commercial benefit, which is also very important. But if you consider, for instance, increase in footfall, I believe the last one, high attendance of patients into community pharmacies, for instance, is that, can we then use the community pharmacy to perhaps...
I use it for what?
Hello. Thank you. Can we then use this attendance, this opportunity, can we take advantage of this to educate the clients who come into the community pharmacy with respect to their healthcare, with respect to whether it is COVID they are running, are they running away from COVID in the hospitals? If they are, can we use that as a discussion point? So those are some of the things that we can look at as part of the research, and then tease that out, and then we can use that to have advocacy, make a case for a policy change or something with respect to the practice of pharmacy in the country. So I think these are fantastic topics that have come up, and I'll open the floor for any, if somebody said something you want to make a comment on, you were in a group, something that you thought was interesting was not mentioned, a way that you think we can sharpen ideas. And this is a good time to do that. I think we can do that in the next 10 minutes, and then we'll wrap it up. So yes, pharmacist John Smith, please go ahead.
Yes, Rector, thank you. Once again, I forgot to share my own observation in group 2. So okay. I share others, then I forgot mine. What I observed after I return home back, when I get back to the oncology ward, to like do what I've been used to do before, I am now considering the knowledge, the exposure to the like standard practice of using the biosafety cabinet. And here now we don't have the biosafety cabinet. So I am now asking myself why healthcare workers do not understand the risks involved in carrying out certain procedure before they do the procedure with regards to practicals. So the exposure to practicals in Ghana, for now, the consultant asked me the other time, he said, John, you are back, but I'm not seeing you coming to mix the medication. I said, my problem now is I'm used to the biosafety cabinet in Ghana, but now I don't have it here. So for me to go and take the vincristine or take the cyclophosphamide and do it how we used to do it before, I said now I've known the risk. So like, I'm not happy or comfortable to do it as I used to do it before. So that was interesting, and it was also shared in group 2. I think that is what I want to add. Thank you.
Great. So I think that one of the ways in which that adds to what we are looking to do is, for instance, that could be something to write something like a policy brief to get the policymakers to understand why we should have these safety cabinets in this kind of setting. So those are things that we can think about, look at how we can, that kind of observation can be used to benefit all health workers, so that health workers understand. So maybe it's also an opportunity for you to share with other healthcare workers the issues of safety, and then make a case for getting that cabinet for not only the benefit of your patients, but also of the healthcare workers who are working in these. Thank you very much, Pharmacist John Smith. And now we will listen to Pharmacist Oscar Bruce. Mr. President, please go ahead.
Okay, I was in room 7 with Sam Tenkran, and he made mention of listening to CNN, where doctors report on health issues. That's specialization. I mean, those reporters have specialized in certain these things. You see, so that they can carry across things within the health sector to the ordinary person effectively.
Yeah.
And it just occurred to me that what we are doing here is specifically to do research and then publish in our peer journals.
Yeah.
Perhaps we have to look ahead so that it should, they should find a way so that what we are able to discover during our researches, we can pass it over on to the ordinary people, to the ordinary people in the ways that they would also understand, because I'm sure some of these things would also help them. I think that we should look forward to that, not only learning among ourselves or sharing knowledge among ourselves, but also educating the lay person and how effectively we can do that. Communication, how we can effectively communicate to the ordinary people. Thank you.
Thank you very much, Pharmacist Oscar Bruce. I think it is a very strong point, which we can really work with. Pharmacist Gloria Ohintechi, please go ahead.
Okay, I was in group 1, and I think both commenters touched on the need for more research pharmacists. They said that most of the research done are by academics. So there's the need for both hospital and community pharmacists to do more research. Auntie Susie talked on public health, the mass drug administration of filariasis. And it used to be done once in a year in Ghana. Now it's done twice in a year. So we can research in that area, whether the 2 dose yearly is helping us, and if it's not helping us, how best we can improve in that area. Dr. Nkansa also touched on proper documentation of both community and hospital pharmacists, because without proper documentation, we can't follow up on any research that we do. She talked on documenting on particular drugs and side effects that even in the community pharmacies, patients report on. So if you are there and continuously, patients are buying certain drugs and they are reporting on certain side effects, we can take that up and even do a research on. Maybe 2 or 3 community pharmacists can come together and do a research on asthma. Anything in the area. There's so much report on flu-like symptoms now with the advent of COVID. So we can also do a research in that area. They were really touching on research, encouraging us to enter into research in the group. Thank you.
Thank you very much. So I presume that everybody in that group by maybe by our next meeting will be bringing up ideas for research which can be sharpened and which can be supported in various ways. And as pharmacist Bruce has also mentioned, as we talk about this research, we also have to look at how we can use that not only as sharing scientific knowledge among ourselves as pharmacists to improve our practice, but also to help the patients and community members to choose healthier lifestyles. Pharmacist Frida Abilba, please go ahead.
Okay, for group 10, we looked at a lot of observational happenings at our various facilities, and we came up with this, the validity of prescriptions in the hospital. We wanted to look at why most facilities, most prescriptions coming to the pharmacies were not valid. So we wanted to look at the reasons behind why most prescribers do that. Then we would also want to find out why prescribers would request patients to bring their medications to validate as to ascertain whether that is actually the brand they requested from when the patients receive their medications from the pharmacy. We wanted to know the rationale behind that. And the other thing was that we realized that most pharmacists are working at their various facilities, but documentation is quite a problem. So we would want to know the reason behind that and to see how the outcome of such research would further help improve the documentational practices of pharmacists. And to also look at whether your time of booking during pregnancy will affect your risk of developing any complications during pregnancy. And we felt that the outcome of this research will be very educational to pregnant women. And then we wanted to also look at some post-marketing pharmacovigilance studies on rivaroxaban. Especially, we're targeting the generic brands on the market to see whether the patients on them had higher risk of bleeding as compared to the branded one, Xarelto. So these were the things we look at that we think we should share to the group. Thank you.
Thank you so much. And I think that one thing that has come up, one, we need, well, not one thing, a number of things. One, we need to document more what we do. Two, we can collaborate in our research. So I hope that after this session, a few teams or groups of us are going to come together and see how we can collaborate to identify the ways in which particular areas of interest to us could be investigated, and to help both our practice and the outcomes, the health outcomes of our patients. So we have gone through quite a bit. We have covered a lot. Today we have identified various areas. I'm sure that as some of us were presenting, the rest of us, some of us were listening and were telling us, oh, this is even an observation I've also made. Oh yes, this is an interesting area, or this part of it is something that we could consider. And so these are all areas that we can all take our time, look at. What we may be writing may not be only the articles, but as I mentioned earlier, some of them may even be issues of policy brief. For instance, if we know that the doctors are not prescribing according to the standard, yes, we may want to find out what percentage of doctors are not prescribing according to the standard, whether it is for diabetes, whether it is for hypertension, whether it is the NSAIDs, whether it is not using what is required by the national drug policy on what the standard treatment guidelines on what a prescription should be. So looking at all of these, we may want to assess those ones to find out how, why, or the numbers, the percentages that are not doing the right thing, and then use that information to prepare some kind of policy documentation to share with maybe the Ghana Medical Association or the Medical and Dental Council or the Ministry of Health to help improve their practices of these prescribers. And I think that if by the end of the year, these are things that have come up, then we would really have made an impact. And these sessions would really have been very, very beneficial. And so I do not know if anybody has any other comments to make. And so I will ask that I think our time is almost up. We gave ourselves up to a maximum of 2 hours, but I see that Pharmacist and Nesque's hand is up. And so I will give him 2 minutes to speak and then we will wrap up. Please go ahead, sir.
Thank you, Madam Rector. I just want to add that I have listened to the various groups, the reporter, and the topics they have submitted. My little observation is that while thinking about the problem, we should also be guided by scope or time. And if you have to do the research, because I heard people talking about trying to find out what in particular is contained in a particular herbal medicine that is causing the kidney problem. Some of these research, if you have to do, it goes beyond, we are looking at maybe a community setting or the hospital setting. The research must be as much as possible, very simple, because it will also address a problem. But if we are thinking we don't have funds, we don't have time, and then you have to bring in other stakeholders, it's like you start the research and then you don't finish. So just want to add that, yes, these are problems, but we should also look at our capabilities or our scope and what we can do so that we don't just state some problems that you see, you start and then along the line, you see that you'll not be able to finish. Because at the community setting, if you have to do laboratory investigations for the patients and pick data, you realize that you'll be constrained. So even though the topic or the problem is nice and you want to research into it, you don't have the capacity. So as much as possible, you should look at what we have and be simple with the topic and then the research. Thank you very much.
Thank you very much, sir. And I would agree with you only to a point, because one of the things we are hoping we can do as part of these sessions is not only to be able to undertake research and write, but also to be able to even write for proposals. So if if it is something that I want to do alone as a pharmacist, then definitely what Pharmacist NSQ is saying is the way to go. Let me find something that I can do which is within my scope, looking at my financial strength, looking at time constraints and all of that, and use that. On the other hand, if I think that this is something which is exciting and maybe there may be some funders who may be interested in looking into this, hopefully when we have finished all of these sessions, we should be able to write proposals, and those proposals should be able to help us to put our thoughts together and look for funding so that we can go wider than our pharmacy, or so that we can get some funding to support the work that we are doing. So yes, if we want to do it alone, then we should make it simple. But if we want to, if we see that it is complicated, we may want to look for funding to do it. And hopefully with this, these are training sessions, we should be able to come there. We'll take one last comment from Pharmacist Agri. And please, I hope you can finish your comment in 30 seconds, because we definitely will come to a hard stop at 4.
Now,
please go ahead.
On share specific one, my next better around 200 or 300 something. So very crowded.
Okay, thank you.
Yes, please.
My comment is also to endorse or talk about what pharmacist Oscar Bruce said. As a community pharmacist, my perspective looks at a lot more of the health promotion that we can also do in our pharmacies when patients come with regards to several other conditions, which through that may help us to also get some observations, and then it would give us basis having a research for a particular thing. It could be in a certain area or a certain community. Several pharmacists could come together. But because we get to see the patients often, a health promotion or taking a task more scale everything may help us to gather data, and that would help us research. Thank you very much.
Thank you very, very much. And with that, we will. It's 4 o'clock, and we are coming to a hard stop. Pharmacist Susanna Edwa Mankwa, 30 seconds.
Okay, I just wanted to agree with you that we should not limit ourselves to the resources we ourselves have, and that there's a world out there where you can source for funds if your question is interesting enough. But I also wanted to say that any research that you want to do, you must, if you want the research to be ethical and you want it to be published, that means you must take the human participation into consideration. And that means you must have enough funds to conclude it. Because if you're going to take that research to an institutional review board on an ethics committee, they would want to see your budget and how you will source for that budget and ensure that the human beings that participate in your research are not harmed by it. So if you want your research to be ethical, you must have the funds before you even begin to start. And that, if you don't, it's unethical to do that, to even begin. So if we look at the research and it's going to take 6 years, and some research does that, then of course we must source for the funds.
Thank you very much. Thank you, thank you, thank you. So at some point in our discussions, there were about 78 of us. Fantastic. Now we are 72. Still great. Thank you so much. We will try in our next meeting. We will, I'm sure once you registered, you got the schedule. And so you know when our next meeting is, but we will send reminders about a week to time so that we will all be on time. And we will do our best. Our target is to start right on time and end right on time. So I'll encourage all of us, when the time is up, please make sure
I think we've been cut.
No, I don't think we've been cut, but
okay, please, I'm back. Two seconds, and then we wrap up. Thank you very much. It is Vodafone that disappointed us like that, but they have restored our connection. So thank you for staying on, and thank you all for coming, and our thanks also to the Almighty God for giving us the grace and the strength to go through this. So all the best, and see you next month. Bye.
Bye. Thank you.
Bye.
Thank you.
Bye.
Thank you.
Bye.
Hey, me quietness is so still.
Hi.
Yeah, bet you.